I'm freezing, body on ice, shivering with cold, mouth pried open, the sounds of a drill. What is that awful smell? Footsteps mean humans, and humans mean pain. Where am I? Have I been abducted? Are they coming to harvest my teeth and my organs? Something is terribly wrong. The year was 2014. That was the year I went from being a nurse to becoming a patient. A vicious assault at work by a patient, and I am another workplace violence statistic. Healthcare workers on average experience workplace violence 4 times as much as any other industry. I've been a registered nurse for almost 30 years. Nurses are attacked almost more than any other profession. Approximately 57 nurses will be assaulted today in the United States. 57 nurses. That's more than 2 nurses per hour. Most attackers are patients. I'm in the ICU on a ventilator. A machine is helping me to breathe. I can't move, I can't see or speak, but I can feel, hear, and smell almost everything, which is terrifying, especially if I was not treated as a person, but rather a body in a bed. You never know what patients may remember. The fog of medications is meant to erase my memories, but the nurse in me fights to recall every touch, every word, every action. I am gripped by fear. I am on high alert, listening for the sounds of footsteps. Someone's coming. Who is it? I don't know. There's no introduction, greeting, or explanation. My blanket is suddenly ripped off. I hear conversations around me, but I can't understand a word. They're speaking a foreign language. I recoil as a cold, wet washcloth is used to clean the mess that's become of me. I am horrified by the smell. I have open sores from all the cleaning. I also have a collapsed lung, pneumonia, a fever of 105 degrees, and sepsis, which is the 3rd leading cause of hospital death. A medically planned coma intended to last 5 days turns into 7 days, then 14 days, then 21 days. I am teetering between life and death. I dream of a white dog and a stage. I cannot wake up.
Welcome to the Hospital Medical Center, the best choice for healthcare in the world. Our menu has changed. Please listen to this message in its entirety to be directed to the correct extension. Press 1 for billing. Press 2 for the emergency room. Press 3 for neurology. Press 4 for cardiology. Press 6 for administration. If this is an emergency, hang up and dial 911.
They are trying to wake me up by playing the hospital marketing jingle at a high volume continuously. Day and night, it never stops, like I'm a prisoner of war. It is making me even more confused and disoriented, and I'm not waking up. I make a promise to myself that if I survive this, I will use my experience and my voice to improve care and recovery for patients and their families. I don't want anyone else to go through what I'm going through. When I was wheeled out of the hospital after 21 days, I must learn to walk, talk, and care for myself. I lost my identity, my career, my home, my savings, my partner, and the nurse practitioner degree I had worked so hard for and was close to completing. Even as a medical professional, I am afraid to this day to seek medical treatment. The post-traumatic stress disorder is so bad, I will wake up every single night screaming for the next 7 years. So about that white dog, ladies and gentlemen, I'd like to introduce you to my best friend, my companion, and my service dog, Mr. Nelson Mandela. Come. Come on. Much of my medical trauma could have been minimized. Some could have been prevented completely. What could have been done differently? Most of it. The way we speak to and provide care for patients suffering critical illness can either cause profound trauma or comfort, relief, and healing. I'm a nurse, and being a patient taught me that we need to work together to reduce the trauma for all patients starting today. Nelson Mandela and I know you want to help, and we thank you.